You're tuned in to More Living with Jim Brogan, broadcast live from the Brogan Financial Studios at News Talk 98.7, where old-fashioned values, expert knowledge, and genuine understanding come together to give you the retirement straight talk you deserve. Jim's a former National Advisor of the Year recipient and a financial educator, and he's here today to talk about how you can live out the best years of your life. Jim and the Brogan Financial team have been helping retirees and pre-retirees across the Southeast for over 20 years in their pursuit of financial independence. You can reach them during the week at 865-862-6800. So sit back, relax, and get ready to learn, because More Living with Jim Brogan starts now.
Hello, East Tennessee, and welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. As you listen to News Talk 98.7 WOKI, it's February, and of course, February is Heart Health Month, and heart disease remains the leading cause of death in the United States. But of course, we know in many ways it's preventable. Care and prevention is getting better and better. A longtime friend of the show, Dr. Jeff Johnson. He's a cardiologist over at University Cardiology. He's on with us again today to help us better understand heart health, from prevention and early warning signs to the latest advancements in treatment. So whether you're focused on improving your lifestyle or managing an existing condition, this is a conversation that could truly save a life. Good morning, Dr. Johnson. Welcome to More Living.
Good morning, Jim. It's good to be back on with you.
Great to have you back on. Let's talk about your background first. What first inspired you, Jeff, to pursue cardiology, and what keeps you passionate about it today?
Well, that's an interesting story. I'll try to make a long story short, but I got a job in my hometown of Cleveland, Tennessee, at the home hospital that is still there today. As an orderly, we don't call them orderly anymore, I don't think, but really as an attendant. But there was a mentor there who was an internist and started the large internal medicine group there. And he was passionate about cardiology. And so I would spend some time with him in the evenings, listening to him talk about different things. And one evening he said to me, "Jeff, I think you should go to medical school and come back and be Cleveland, Tennessee's first cardiologist." And it really was almost prophetic. I changed the direction of my life and did do that. I practiced with Chattanooga Heart, and we opened the Cleveland office more than 25 years ago, because I've been in Knoxville for 25 years. And I went to medical school knowing exactly that's what I wanted to do. And the heart, connects with emotions and life. People talk about how's your heart today. People talk about a broken heart. People talk about a cheerful heart. I've always appreciated the symbolism there and speaking like you're dealing with the real person when taking care of their heart.
Jeff, for listeners who may not, there's some misconception about cardiologists. So talk a little bit about what you do on a daily basis and maybe even what you do not do.
I can easily answer that. We see a lot of patients for various symptoms such as chest pain, shortness of breath, heart palpitations, blood pressure issues, management of risk factors that I'm sure that we'll probably talk about during this segment. We sometimes do procedures, non-invasive procedures such as echocardiogram or stress testing, CT scan of the heart, and then we do invasive procedures such as heart catheterizations. Cardiologists also do ablations of things like atrial fibrillation and other arrhythmias, and cardiologists also place stents. I don't know of any cardiologist that does all of that. I don't do all of that. I do a lot of what I just mentioned. The one thing that we don't do is when we do a heart catheterization and recommend bypass surgery or valve replacement surgery or valve repair surgery, the patient will look at me and say, "Now you're going to do this, right?" And I say, "Oh, no. I am not a cardiac surgeon. I'm going to find a cardiac surgeon for you who will do that, and I'll work in tandem with him or her and get you through this." And then, honestly, the surgeons, once they get you through the procedure, they turn you back over to the cardiologist for the rest of your life. So I think that's
so really the
sometimes.
Yeah, the cardiologist, you're managing all of the patient's heart health, but then you have other specialists that can sometimes be involved. What makes it, in your view, Jeff, what makes practicing cardiology? I mean, you're university cardiology over at the University of Tennessee, practicing over there at UT. What makes that unique compared to other institutions, in your view?
Well, we're a teaching hospital. We call it the Academic Medical Center for the region, and that allows us to teach fellows and residents and even medical students who come over from UT and Memphis. That is one unique aspect of what I do, and one of the reasons 25 years ago that I came to UT. And then the other thing, though, is this is not always a good thing, but I know all hospitals in town are busy. I know all hospitals in town are filled to capacity, but at UT, the floodgates just seem to stay open, and we see a wide variety of patients. We see all sorts of pathology and all opportunities for learning, as we say, but also to grow and develop and to be better and to try to stay on top of the field for our patients. So there's never a dull day at UT Medical Center is something that I like to say.
Yeah, I'm sure that's the case. This is Heart Health Month. We're visiting with Dr. Jeff Johnson over at University Cardiology. Let's get into heart disease itself. Jeff, what is one misconception that people often have about heart disease?
I think that when people think about heart disease, they think about heart disease, and we take care of this, such as chest pain and heart attacks or acute myocardial infarction, and taking care of them in the setting. And we do that. I think what people don't realize is that heart disease can be very silent, and I'm sure that we may end up talking about this. We know that plaque development in the coronary arteries can be very early in life. We also know that people can be born with valvular heart disease. And we also know that your heart can be perfectly structurally normal, and you can still have arrhythmias that cause palpitations or heart racing episodes, and in extreme cases, passing out episodes. And we see those in college students often, or even high school students. So the misconception is that it's an old person's disease and it's just heart attacks and blockage, but it can be so much more, including valvular heart disease, even congenital heart disease and arrhythmias. And then, of course, now that we've had people with all of our amazing, wonderful technology that has evolved even in my career lifetime, we have patients living older and longer. And so heart failure has basically become pandemic to even epidemic across this country and around the world. So there's so much more than what people typically think of, the chest pain, the heart attacks. There's more to heart disease than that.
Well, I think your word there that it develops over time. It's just kind of like people say cholesterol is a silent killer because it just kind of sneaks up on you over time. Along those lines, what are some of the most important early warning signs of heart problems that people tend to ignore or block out or say surely that's not what that is?
I think even in the absence of symptoms, if you have a very strong family history, I think that once you reach, and there is no established guideline of this that I'm aware of, whether it's 21 years of age or 30 years of age, if you have a strikingly strong family history, meaning your mother or your father had their first heart attack in their 20s, 30s, 40s, I think that even with no symptoms, once you reach adult age, some sort of screening ought to be done either with your primary care physician or with your primary care physician in conjunction with a cardiologist. I think that especially in the setting of risk factors such as a family history, or if your blood pressure is high, or if you're overweight, or if you're a diabetic, and you have any of those symptoms that I mentioned, such as chest pain or shortness of breath or extreme fatigue, I think starting with a primary care physician first or coming straight to a cardiologist is certainly very reasonable. We always say we'd rather check it out and make sure everything is completely fine and good rather than be surprised at 3 a.m. in the middle of the night with acute symptoms.
Yeah, I remember. We want to be very in tune to our bodies. I remember, you may remember this, Jeff, but it's probably 15 years ago. I was in my early 40s, and I just kind of felt kind of strange, felt some tightness in my in that heart area, and I figured it was probably nothing, but I called you and you're like, you know what, Jim, let's just be careful. Come in, let's do a stress test. And it turned out to be nothing, thank goodness. But man, we got to start tracking this stuff early on. When do you think people should start getting annual physicals and really do annual checkups and start screening for all their health needs?
I think an easy way to say that is once you've gone through high school, and if you end up going to college or some sort of graduate school or even training school after that, once you start your adult life, you know, our kids are all older, Jim, and my daughter, who's engaged, lives in Atlanta, and she's 26 years old, and she has said to me countless times, Dad, I'm not really fond of adulting. The last time she said that when she was trying to get a tire fixed on her car. But that being said, I think that once we start adulting, it's a good thing to see your primary care physician once a year, and it's a good thing to see, you know, your dentist once a year and all of those things. I think that's once we start adulting, I think is good.
That's a great word. That's Jeff Johnson. He's a cardiologist over at University Cardiology. It is Heart Health Month. When we come back, I want to talk more about specific things we should be doing to screen for issues, and I want to talk about prevention and lifestyle. So stay with us. This is More Living with Jim Brogan here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back to More Living here on News Talk 98.7 WOKI. I'm Jim Brogan. It's Heart Health Month, and cardiovascular disease is the number one killer in America. And our guest, Dr. Jeff Johnson over at University Cardiology, are saying as people living longer and longer lives, it just makes it even more really an epidemic or even pandemic type levels with cardiovascular disease. Dr. Jeff, how often talk about what screening for cardiovascular disease looks like? I mean, to me, I think, okay, at a young age, I'm going to start doing annual physicals. I'm going to get my blood pressure checked, and I'm going to start getting my cholesterol and other blood work, triglycerides. Is that where it starts?
That is where it starts, Jim. And then I think after that, your doctor is going to look at your risk factors and decide whether there needs to be more additional testing. I think the latest development since you and I even started doing this almost annually years ago is that if there is a strong family history, and maybe we can talk about this in more depth if you like, if there is a strong family history, we can now do a very simple test called a CT coronary calcium score. I think there's a lot of misconception out there now about the calcium score, but when it comes to a screening examination, in other words, this is the typical time that I will order a CT calcium score. A patient will make an appointment to see me, and I'll walk in, and I'm looking at a healthy-looking patient, often very fit and active-looking, and I'll say, well, what brings you here? And they will say, well, my dad is your patient. He had a bypass 8 years ago, 10 years ago. My mom is your patient. She had a heart attack and got a stent. And I look at them and I say, you just want to know if you have your mom or your dad's genes. You just want to know if you have heart disease. Yes. Well, do you have any symptoms? Oh, no, I'm very active. I go to the gym 3, 4, 5 times a week. I have no chest pain. I have no shortness of breath. And I look and their blood pressures are good. Their EKG is stable. And I'll say, well, let's just do a coronary calcium score and see if you have any plaque in your arteries. And if you do, we can start early treatment so that, Lord willing, you will not walk in the same shoes that your dad or your mom did. And then if your score turns out to be 0, I can't say that you're 0 risk, but I can say you're extremely low risk to have any kind of cardiac event in the future. And so until that came
in the future
along,
meaning In the future, meaning how many years? I think you said you told me one time it's good for 5 years.
I think, well, the calcium score, my personal belief is I'm not sure that it ever needs to be repeated. But if your score is 0, I don't know that it would ever need to be repeated. But if your score is above 0, we say less than 100 is still low risk. 100 to 300 is intermediate risk. We say, okay, you have coronary artery plaque there. Let's look at your lipids. And if we look at your cholesterol and your LDL cholesterol is abnormal, then we sometimes can pull out our phone, and there's an app that I keep on my phone called the ACC Risk Calculator that's developed by the American College of Cardiology. And if your risk is above a certain percentage, we might recommend for prevention going on most commonly statin therapy, and there are now other therapies besides statins that we can use. And if your score is 0 or extremely low, I'll just say, you know what, we should look at your lipids again in 1 year, maybe 5 years. But if your score is abnormal, then we just follow the lipids and treat accordingly, and there's no real reason to repeat the calcium score. I've seen calcium scores as high as 5,000, and I've seen people with strong family histories have a score of 0, and I just look at them and I say, well, it doesn't look like that you got your dad's genes, and for that you can be thankful. We still encourage a healthy lifestyle, taking good care of yourself, et cetera, but I think you're pretty low risk for cardiovascular disease. I think for your lifetime.
Now, the calcium score, that's pretty easy to get, right? What's involved? Does somebody have to have a referral, or do they have to have their cardiologist book that for them? How can somebody look at that?
Well, it's usually done by referral, but I think that you can call our facility and actually get a calcium score. It is such a cheap and easy test that it's not worth insurance companies messing with it. So it's not covered by insurance. It's $99. And this used to be a joke. I used to say to my patients, it will take you longer to park in our parking garage than it does to get your calcium score. But since our parking garage is so busy and overwhelming to so many people, I don't say that usually anymore. There's no ID. There's no ID. There's no dye. You just lie down on the table, and they sweep you through the scanner, and then we actually score the plaque in your coronary arteries. I think that you would be more familiar with this than me. Years ago, there was a financial commercial on television that'd say, know your number. What's your number? And in this case, I say it's a good thing to know your number. What's your coronary calcium score number? And really, it should just be a one-time screening thing, I think. That's my opinion. There are other people. It's been out long enough now that I see people getting repeat scans 5 years down the road, and I get asked about those, and honestly, I don't know usually what to do with that information, but we figure it out one way or the other.
Now, I think people have learned enough about heart disease that we know, you've mentioned family history several times, so genetics certainly can play a part, as can lifestyle. Talk about the things that we can control, Jeff. It's interesting. I heard a trainer one time, he said 75% of how you look and feel is what you eat. Let's start with diet and go from there. There's so much controversy, low carb, South Beach. What are your views on a healthy cardiovascular diet?
Early in my career, I actually made it a point to read several of the diet books because I would get asked about this so often. I have read Dr. Atkins' book, the original extreme low carb book, and there are proponents of that who just swear by that. You mentioned the South Beach diet. I read the South Beach diet book from cover to cover so that I could better educate my patients. I've read a book on intermittent fasting. I have read a book on the carnivore diet. And finally, more diet books kept coming out. And I said, my conclusion, and I've done this from attending conferences and continuing medical education and being interested in this subject, not only for myself, but for my patients. The one thing the one thing that impacts our not just cardiovascular health, but overall health and longevity, reduction of cancer risk, joint problems, etc., is caloric reduction. And maybe I'm an easy answer, high-level person to a fault, but what I say is that for some people, intermittent fasting works wonderfully. For some people, the Atkins diet actually works. For some people, the carnivore diet works. Whatever can help you reduce your calories over time contributes to your longevity. And I think that trying to follow a basic Mediterranean diet of fresh fruits and vegetables, healthy nuts, mainly fish and grilled chicken compared to red meats, etc., is still the overall most healthy approach to not only heart health, but general health. And for some people, intermittent fasting helps them do that. And for some people, it does not. And I think that sometimes you have to do some self-experimentation to see what works best for you. And so that's my spiel that I now share with my patients when I get asked about that.
Well, you've known me a long time, Jeff. Dee Dee and I both are meat eaters. We love our beef. We love our red meat. How harmful is that? How often can I eat red meat? Is if I stick with leaner meat, does that make a difference? If I do grass fed, and then what about eggs? I mean, that's a big popular one that people talk about. I mean, I've never thought eating egg yolks, there was much data behind it being that bad for you, but then others say that's not true. Talk to us about meat and eggs.
Meat and eggs. There's a lot there. I think my answer to the meat question, first of all, is what I will say to patients also when they ask me about meat. They'll say, I have one patient who not too long ago looked at me and said, now, Dr. Johnson, on Friday night, I like to have my steak. And I said, good. I think that's wonderful. You got a tradition? Yes. Yes. My fiance go out every Friday night, and I love to have a good steak. Got a couple of different places I like to go around town here, and I just love to do that. And I said, great. I think you ought to continue that tradition. Enjoy yourself. You just can't do that every night. And he kind of smiled and said, yeah, I get it. I love sweets. If I knew and it was proven that sweets were good for you, I would eat sweets 3 times a day and then have some peanut butter cookies before I went to bed. I don't do that because I know that that's not very healthy. I pick my battles, as they like to say, and I do occasionally have dessert and occasionally have a couple of cookies here and there. I could eat more of them, but I don't. I also, Jim, this is just me. This is not necessarily the American College of Cardiology guidelines. I know that life is short, and so it's just extremely hard for me to look at a patient and say, you can never have that steak again. And I know that people have been told that by their doctors, and I'm not necessarily being critical, but I just go, look, if that's a Friday night tradition for you or a twice-a-week tradition for you, and it makes you happy, as long as you're doing the other things within balance, and we've not talked about exercise yet, if you're walking or doing some sort of cardiovascular exercise 5 to 7 days a week and your weight is stable, your blood pressure's good, we've got you on good treatment for your lipids, enjoy your steak on Friday night and live your life. What is your slogan? Help you to live your best life?
Live your life, best years of your life your way.
Yeah, there you go. That's what I believe in, and that's why I appreciate so much what you do and what you say on your program. So,
well, thank you. But food's a big part of our lives, right? I mean, it's a part of our social arrangements, social engagements, and a lot of the things we do. So, it's interesting. We say everything in moderation. It's interesting that you ultimately came back to you have to have, and it's what nutritionists say. You have to ultimately put your body in a caloric deficit or if you want to lose weight, but ultimately you have to have a healthy caloric balance, calories in versus calories out. And I know you said, you like the Mediterranean diet particularly. But all that's important. We need to be aware of what we're doing, but also not deprive ourselves of something that's a very important part of our lives. This is Dr. Jeff Johnson. He's with University Cardiology. When we come back, I do want to get into exercise. We'll also have our dollars and cents segment, Wealth Transfer 101, understanding what does your will not cover when you pass away. Might surprise you. Stay with us. This is More Living here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back to More Living with Jim Brogan, where it's all about living the best years of your life your ways. You're listening every Saturday, 9 to 10 a.m., and again 3 to 4 p.m. We're visiting with Dr. Jeff Johnson from University Cardiology. It is Heart Health Month, talking about cardiovascular disease, prevention, all those things. Before we get back to Jeff, however, it is time for dollars and cents.
Want to be sure you are getting the most out of your retirement? For all the years of your retirement? That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now, here's Jim with this week's Dollars and Cents tip.
Understanding how our assets actually pass when we are gone, and kind of Wealth Transfer 101. What does your will cover and what does your will not cover? So it's very, very critical to understand these kinds of things. Number one, we have a lot of assets that we own that our will has nothing to do with who gets what. And the central one would be things we own jointly. You know, if I own my house with my wife, joint with right of survivorship, or joint by the entirety, meaning if I die, my wife entirely owns she has the survivorship benefit. So it doesn't matter if I put something in my will that when I die, my house goes to this person. If my wife's name's on the title, then she's going to get the house. Another thing would be if we name a beneficiary designation. You know, when we open up our biggest issue here would be our retirement accounts. You know, when we open up our retirement accounts, we're asked on the account application to name a beneficiary. And we typically don't think anything of it. We say, well, I'm going to name my spouse if I'm married and then my kids. What we have to realize is that beneficiary form supersedes the will. It has total legal authority and control over who gets what. If you have a living beneficiary, it doesn't matter what's in your will. This comes a lot into play with divorces, second marriages, things like that. We'll see people get a divorce. They redo their estate planning. They redo their wills, all their legal docs. They don't think to change the beneficiary designation on their 401k or their IRA. And they die, and they've named their ex-spouse the beneficiary. Well, that takes precedence. That supersedes the will. And then the will is important, certainly. You know, if we own real property, the only way that we can get it to someone at our death is through the estate, or if we were to place it in a trust, then the trust document would govern that. And so that's where the legal documents really come into play. But it's so important fundamentally to understand some things that I own, you know, how do they get passed? If I own a property with my brother and we own it, how can we own it where my half goes to my kids and not automatically to him? That's a different type of joint ownership called tenants in common. So it's just imperative to understand how we title things, how we name beneficiary designations, and what the will covers, what it doesn't cover, and how we incorporate a trust. These are the basic kinds of estate planning 101 things that I think everyone needs to know.
That's our Dollars and Cents segment for this week. You can find this week's Dollars and Cents segment and others by visiting BroganFinancial.com.
I'd like to invite you to my next class. It's through Pellissippi State Community College. It's through their community and out services. It's adult education. And it's coming up on March the 5th. Tax planning and your retirement. It is a one-night class, 2 hours at the Hardin Valley campus about taxes. We need to understand the history of our income taxes, where are we likely headed in the future. What about the deficit spending and the federal debt? What does that mean for us down the road? Understanding the One Big Beautiful Bill Act. All these things we'll talk about in this class through Pellissippi State at 6:30 to 8:30 p.m. Again, Thursday, March the 5th. So in a little less than 2 weeks, Thursday, March 5th, you can go to BroganTaxPlanning.com. You can download a syllabus, again, BroganTaxPlanning.com, and you can also click a button to go register directly with Pellissippi State. I'd love to see you there. I think that what's going to happen over the next 10 or 15 years with our tax system and what it means for cost of living and inflation and all those things is going to be critically important in our planning. So do check us out at that class. We're visiting with Jeff Johnson. It is Heart Health Month. He is the university cardiologist, long time friend of the program, actually very dear friend of Dee Dee's and mine as well. Great guy. And Jeff, let's talk about exercise. You know, there's resistance training, there's cardiovascular exercise, getting our heart rate up. You know, some people say intense exercise is important. Others say get out and walk every day. What's the right amount of exercise? How do we get started if we're not doing anything?
Well, that last question, Jim, is a great question because I think too often we see people decide that they're going to exercise and maybe they overdo it at the beginning and become sore or excessively fatigued and become discouraged. So anyone who's going to start an exercise program, regardless of what they're doing, I always say start gradual and slow. I remember the old story by motivational speaker Zig Ziglar. He said he was 40 pounds overweight and said he wanted to run. And the first day he made it to his mailbox and almost collapsed. And the next day he made it down the street. By the end of the week, he could run around the block. By the end of the month, he could run a mile. And then he began running 4 to 6 miles and did that for the next 40 years of his life, which I share that with my patients often. As far as the types of exercise, I say that walking, you just can't walk too much. The American Heart Association recommends 150 minutes of aerobic cardiovascular activity per week, which is easily broken down into 5 days of walking 30 minutes a day. If you want to walk more than that, I think that's great. I tell my patients you can't walk too much. And then my personal belief, I'm not great at this personally, but my personal belief is that adding in some sort of strength training as we get older, strength and balance training to help reduce the risk of falls, help maintain muscle mass. All of that is helpful. And as you know, dealing with your clients, Jim, and more and more people either have trainers or they go to the gym to help with exercise such as weights and resistance training. And yeah, I have plenty of patients who say, well, I walk 5-6 days a week, or I run, or I cycle, or I use my elliptical, and then I go to the gym and they help me with some strength training. I think that that's the best overall approach to long-term health. Again, not just for cardiovascular health, but your overall health.
Yeah, and I'm going to say, you know, as I'm getting older, you know, resistance training doesn't have to mean lifting free weight. Or even machines. I mean, with the different tools that are available, we have our body weight, which provides a natural way to do resistance training. There's a lot of bands and things like that. So it doesn't have to be complicated. It doesn't have to be risky. I think accountability, you know, you said get with a trainer or go to the gym where somebody can spot them. Can you talk about, in your view and what you've seen in your own life, the importance of accountability?
Oh, it's huge. So many people, I've had so many patients that'll come back to me for their annual visit or their 6-month visit, and I'll say, well, how's your walking program going? And they'll look at me and they'll say, well, not as good. I used to have one of my best friends who we would meet at the park 4 days a week, and we would walk for 45 minutes, and now she's taking care of grandchildren, or now he moved away, or something like that. And so once that happened, I kind of fell off, and I've not gotten back into it. So we try to have a conversation about that. I know in my own life, where I live, downtown in a condo building, I get up and have a quiet time very early in the morning. And before I run, there's an older gentleman, a little older than I am, but a dear friend who lives here. He's already out there running, and I can see him running with his little flashlight. And I'm like, okay, Alan's out there running. I know I got to go. And then we'll see each other, and I'll say to him, you're my inspiration. And I think that accountability helps and matters. And I think that once you realize that you actually feel better, once you develop some sort of routine, some sort of self-discipline, it feeds on itself, and it helps it become easier to maintain, as opposed to, like I said a couple of minutes ago, if you go out and do something extreme and crazy and then become sore and discouraged, I think that it's going to be harder to maintain a program that way.
Yeah, I'm a big believer too, Jeff, in doing something, an activity we enjoy, or activities that we enjoy, playing tennis, playing pickleball, getting out and walking through the neighborhood. I mean, I hate getting on a treadmill, so I'd rather get out and walk in the neighborhood, even if I have to bundle up this winter, than get on a treadmill and just be looking at a wall or whatever. So I think doing activities that make us active and move around and walk and all those things are so important. We're visiting with Dr. Jeff Johnson. It is Heart Health Month. He's a cardiologist at University Cardiology. When we come back, I want to wrap up, Jeff, with technology. Where are we headed? What are some new things that are available? What are you seeing in the world of technological advancement in cardiovascular care? And what about AI and its influence? So stay with us. This is More Living with Jim Brogan. This is News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
And it's Heart Health Month here at More Living with Jim Brogan on News Talk 98.7 WOKI. And we're visiting with Dr. Jeff Johnson from over at University Cardiology. By the way, Jeff, and I'll keep this brief, but I want listeners to know a little bit more about you. When you talk about Jeff Johnson, the person, what's something about you that a lot of your patients may not know or realize? An interesting personal thing.
Well, an interesting question. I think that, we don't talk a lot about ourselves personally when we're seeing patients, but I want people to know that I have a strong faith, and I'm committed to that. And I teach a wonderful Sunday school class at Church Street United Methodist Church downtown, with the average age of the class being about 80 to 85. And I just love those dear folks. That's something people don't know about me. I have 4 adult children who are all wonderful and healthy and good. And I have no grandchildren yet. But I don't know. And then I've just been passionate about my practice and taking care of my patients. I grew up on a farm. I still own the farm in Cleveland, Tennessee, in the Polk County, Bradley County area. Been in my family for 5 generations. Just some unique
Well, I know
things
one
that
thing about you too, Jeff.
Know.
And I know one thing, you're a music lover, right? I mean, you're a singer, songwriter. You've got perfect pitch. Quite the musician.
Yes. Well, thank you. I appreciate that. When people ask me about that, I just say, well, I have to keep my day job.
No. We've done music over the years, and it's been great. We don't have much more time, but let's dive into technology. What are some of the most exciting advancements you've seen in cardiology that's happening right now at the University of Tennessee with technology and those things?
Well, we mentioned the calcium score earlier, which is a CT scan. I think that the next wave of technology in cardiology, when it comes to at least non-invasive procedures, is going to be the CT. Now, when people hear us talk about CT in the heart, the calcium score is one test that we can do, but the next test that sometimes is done is called a CT coronary angiogram, where we do inject contrast dye, the same dye that we use in the catheterization laboratory, to visualize the coronary arteries and to visualize the plaque. And you mentioned artificial intelligence. I think that it's already in the marketplace now that there are AI programs that will help us characterize these plaques as being low-risk plaque, intermediate-risk plaque, or a high-risk plaque. A high-risk plaque is one that is vulnerable to potential rupture, and a ruptured plaque is what causes an acute myocardial infarction or a heart attack. And right now, the best cardiologist in the world can just look at an angiogram and see plaque there, and maybe it's a 30% plaque or a 70% plaque. But that same angiogram could be repeated in 20 years, and we don't know if the 30% plaque and the 70% plaque are both going to look exactly the same, which they can, or in 20 or 30 years, the patient comes in with a heart attack, and we do the angiogram, and one of those, either the 30% or the 70% plaque has ruptured, and now the patient is having a heart attack. I think that with AI and CT, we are going to better be able to characterize those plaques, and there will be, of course, treatments developed to help us reduce that. I've always said, to say that the person who discovers, or the research team that discovers how to identify the vulnerable plaque, the plaque that's going to rupture, to say that they'd win the Nobel Peace Prize, that's not even as great an honor. It will change the world because, as you said, it's still the number one cause of death in the world today, and we still don't know, even with all of our technology, how to identify that plaque that's prone to rupture. But I think that CT and AI are going to be maybe the next step in that research and development. And then just one quick thing, as far as technology, my interventional colleagues, I still do heart catheterizations, but I don't put in stents like my interventional colleagues. I think that the technologies that they have to fix blockage, to fix plaques, continues to evolve in just amazing way. We see people now who are either too sick or their anatomy is too complicated for bypass surgery, and my interventional colleagues are able to go in there, and sometimes it's a prolonged procedure with some risk involved, but actually basically redo the plumbing of their heart, as they say. And I think that technology continues to evolve. And then one last thing where technology in cardiology is just amazing is in the arrhythmia space, when atrial fibrillation ablation procedures first came on the scene several years ago, they were taken 4, 6, and 8 hours. And with the latest technology, my electrophysiology colleagues are able to do an AFib ablation sometimes now in an hour or even less. And I think that technology is going to continue. There's new things in valvular heart disease that we probably don't have time to talk about, but it's an exciting time in medicine. And then the final, it's not necessarily a technology, but new drugs for prevention, new drugs for weight loss, new drugs to help people's diabetes regress and become less of a factor in their cardiovascular health. It's an exciting time, and I'm constantly amazed at what continues to be developed in our healthcare system today.
That's Dr. Jeff Johnson from University Cardiology. We've learned so many great things, Jeff, about diet, about exercise, nutrition, screening, all these things. You've always been a great friend of the show. Thank you so much for taking time out of your very busy schedule to come on and share with us some wisdom and great tips about getting healthier, staying healthy, and prolonging a quality of life.
Thank you, Jim. It's always fun. And I just so admire what you do with the show. I've watched this and listened through the years, and I just think you do an amazing job. And you didn't ask me to say that. I just want to compliment you on what you do for our community through your show and through your firm.
Well, thank you so much. I appreciate that. Dr. Jeff Johnson, longtime friend of the show, and Dee Dee, my personal friend. Known Jeff a long time. He truly cares for his patients. We've discussed your health because greater health provides for more living so you can live the best years of your life your way. Many thanks to Wayne for engineering the show and Mary Caroline for helping produce the show. This is More Living with Jim Brogan, only on News Talk 98.7 WOKI.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.